Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, thank you for joining us for today's webinar, where we'll be discussing the impact of COVID-19 has had on the PPE and home care. We're going to look at lessons learned and best practices to help us continue to manage the current pandemic situation, as well as prepare for the future. My name is Tammy Ross. I'm the Senior Vice President of Professional Services at Axxess. Axxess is a leading home health care technology company offering a complete suite of easy-to-use, innovative software solutions, empowering home health, home care, and hospice providers to grow their business while making lives better. Joining me today is Kendall Stricko and Rob Gutsall from Cardinal Health at Home. Kendall's currently the Manager of Clinical Solutions for Cardinal at Home Health and Hospice Supply Distribution Channel. She's been working in the HME and home care supply chain space for the past 15 years in sales, product sales development, project management, and clinical solution roles. She currently resides in Cleveland, Ohio, with her husband, 3 daughters, and a yellow lab. Rob is currently Director of National Accounts for Cardinal Health at Home Health Hospice Supply Distribution Channel. He's been working in home care supply distribution for 15 years in sales, marketing, and business development roles, focusing on optimizing supply management for home care organizations throughout the country. Rob resides in Atlanta with his wife and 4 children. Before we begin, a few housekeeping items. Axxess will be providing 1.0 continuing education credit for this webinar. All registered attendees who want to receive those credits must be present for at least 45 minutes of today's webinar and complete the post-webinar training evaluation. Certificates will be emailed to the individual's emails registered for this webinar. Your phones have been muted, but you may submit questions through the question function in our platform GoToWebinar. We will answer as many of those questions as we can at the end of the webinar. If we're not able to answer your question during the webinar, we will follow up with you afterwards to respond to your questions. Slides from today's presentation, along with a recording of the webinar, will be available and will be sent to all registered guests via email. This will also be posted on our Axxess.com site. So I'd like to welcome Rob and Kendall. And Rob, I think you're going to kick us off. I'm very excited to hear this presentation and looking forward to it.
Thank you, Tammy. We are as well. And everyone, appreciate you joining today. Thanks for your time and your interest in the topic. And as you saw in the registration sign up, the objectives of today's presentation and discussion center around PPE and how COVID-19 has really forever changed the way that we'll be viewing PPE moving forward. And we have the discussion and presentation segmented into different blocks. So essentially, what was the PPE world like before COVID-19 became such a dominant aspect of our lives, and then during the pandemic, how we reacted to it, what's going on, essentially how are we living and working through the needs that we have today, and then we'll take a look post-COVID and how we need to apply the learnings that we've had, many of them hard learnings, to what the world will look like moving forward, and really how we'll adapt to better prepare for PPE and related products and needs in home care moving forward. So to get the webinar kicked off, and I think an interesting way, we want to take a quick poll. We're going to have a couple of these throughout the discussion here. So everybody be prepared here to answer the initial question. I'll flip it to Tammy to ask the question, and I appreciate your input on this one.
All right, so we'll just give it a few minutes. You should see our polling question jump up, and we'll give you about 30 seconds to answer this. In early January, What was your biggest concern before COVID-19? Was it cash flow, staff shortages, patient issues, or lack of supplies? And again, if you'll just go to your poll and vote for us, we'll share the results of that poll. Okay, thank you for those that are voting. We'll give that about another 5 seconds to close out the poll, and then we'll post those answers for you. And Rob, what do you think people are going to say? Just interested to find out your thoughts.
Great question. It's, you know, right, PDGM was kicking in, and so obviously, you know, cash flow is topical. You know, I'm thinking, you know, the top three at least are going to dominate. So
yeah, I agree. Let's see those results there. Cash flow at 27%, staff shortages at 21%, patient issues at 9%, and still a lack of supplies was coming in there at 24%. So I'll give.
Well, yeah, I think, you know, and asking the question, I think, you know, the thought was, you know, before COVID-19 became, you know, a dominant scenario in everyday life, you know, we really expected a little bit higher in the other categories. And Dr. Andrew, if you flip the page here, Axxess had done a survey back in late March when, you know, the issues around COVID became so much more dominant on the landscape, and so the lack of supplies, you know, outstripped even, you know, cash flow, patient issues, and staff shortages at the time, and so again, just to reiterate, this you know, this topic was absolutely topical in you know, in this year, and so interesting comparison, and you know, I think it's illustrative of why everybody's here today listening and discussing the topic. So let's revisit a little bit of pre-COVID information here, and the OSHA's definition of PPE is listed here. So as you read through the specifics, obviously it encompasses more than, you know, what we have typically used in home health care, but bottom line is you know, there's a list of specific items that you know, all industries that need to adhere to when you know, the need for personal protective equipment is in play. And so while OSHA defines it as this, in home care essentially boils down to 4 product categories. If you'll advance the slide for me, Dr. Andrew, that gloves, mask, eye protection, and clothing are the primary categories for traditional home care PPE that we've you know, all adhered to through these years. And Kendall's going to take a couple of minutes here and kind of go through each specific item and point out some highlights. And again, a lot of this is pretty straightforward stuff, but we just want to set the tone for, you know, how things have evolved and changed over the last few months. Kendall?
Absolutely. Thank you, Rob. So moving into gloves, obviously everyone is very well aware of the gloves that are out there, but just to hit on them, you've got your nitrile, vinyl, and latex. Typically, from what we see, nitrile makes up about 75% of the glove purchases. Then following behind would be the vinyl. You know, typically vinyl is more or less used for patients, you know, left at the home for, you know, any other caregiver use, and a lot of times for aides. And then you got the latex. Typically, we're seeing only about 1 or 2% of that usage wrapped up in latex. Typically, many agencies have gone latex free, not only with gloves, but as a standard for their formulary to avoid any type of potential latex exposure to somebody that may be allergic. So moving on to masks. As you're all familiar, surgical, you've got your typical, you know, ear loop surgical mask, 3-ply, you know, different levels of protection. And then you have your respirator styles such as the N95, which, you know, essentially is the gold standard out there for the masks. Eye eye protection. You've got face shields, goggles, and then the mask with eye shields. Typically, we haven't seen in the home care space, at least, a ton of need or very little need for the face shields. But now more than ever with COVID and just adding that extra layer of protection, we're definitely seeing an increased demand on the face shield front where we typically never did before. Then you've got your clothing piece. So this would include gowns, head coverings such as bouffant covers, and then a wide variety of different types of shoe covers as well. So this is an interesting quote that we found here. I think as everyone's well aware, many PPE products are made not in the US, they're made overseas. But looking at this quote here, showing that specifically when looking at masks, 95% of the surgical masks and 70% of the respirator styles, like the N95s, used in the US are made overseas. So keep in mind that is pre-COVID state on where all this product is coming from. And I would say that this is very similar, not only with masks, but as you look across all PPE products. So it only works when it's used, right? Pre-COVID, many PPE products we are seeing were in low demand, considering, or product was purchased and then the next time, let's say a gown was purchased or an N95 or a mask was purchased, months or even potentially years. So just a lot of the data was showing that PPE in general pre-COVID was being used not abundantly. So another interesting quote that we found here, when you're looking at OSHA guidelines, when it pertains to PPE, because when a clinician or a caregiver is going into a patient's home, because it's not the home health or hospice agency, they're exempt from requiring the use of PPE. Again, we're talking pre-COVID state, but obviously all agencies have their own protocols for what they set on protecting their staff members. And then from here, I will pass it over to Tammy to go over our next polling question.
All right. So if you'll get ready for the poll, we're going to pop that question up for you. And we're going to talk about staff adherence to our organization's PPE clinical practice protocols in May compared to January. So do you think your staff is about the same as they were in January? Are they getting somewhat better or are they substantially better? So if we'll give you a few minutes to answer that, and I know a lot of organizations have gotten much better at monitoring this just because of the shortage. So I'm really interested, Kendall, to see what these responses come in at. Where are you thinking it's going to land?
I'm going to say substantially better.
All right, let's see what those poll results say. I agree with you there. And we have 4% about the same. Look at there, 21% somewhat better. And we're right, 75% have gotten substantially better. So that's really good to see that. All right, Kendall, I'll turn it back to you.
Okay, so now we are moving into the living, we were talking pre, now we're talking living current state where we sit today. And Rob, I will pass it over to you. Actually, no, I lied. I will take it from here. So just to touch on the timeline here, as everyone is aware, starting off here, February, March, there were little to no cases, at least confirmed cases. From there was a large ramp in March into April. Things calmed down a little bit, and now, heading into end of June, we're definitely starting to see, a spike, definitely hot spots throughout the United States where the cases are creeping back up. So if you take a look at this graph here, this was actually really interesting data that we were able to pull here. If you look at the blue line, we're talking about ordering activity from volume. So the blue line is indicating orders or POs that were placed for PPE. The dotted line is indicating actual product that was received. So as you can see, November, December, what was needed for PPE and what was, trying to be purchased and obtained. The dotted line, we were, receiving what we needed. Little tiny uptick into January, February, you're talking cold and flu season, so it's understandable. Once February hit though, you see that demand or that, the PO volume skyrocketing. And then you see the dotted line of inventory that was actually received, which you can see was a big disconnect. And this is where the industry really started feeling the pressures of not having the proper amount of PPE. And then I know it looks a little weird. You'll probably ask yourself, well, how did the POs or demand essentially go down from March to April? We hit a time where essentially manufacturers they had expanded all product that they had. So you'll see that slight downtick in the POs placed because many manufacturers essentially stopped taking POs. They weren't even accepting new orders. So, that obviously drove down what we were able to place as far as trying to get product. And then, when that let off a little bit, right, you see it go back up in April, but the actual product from April to May substantially went down. And we'll get into that a little bit later as far as the constraints on manufacturing and what led to that, decrease in received product of PPE. So the next slide here shows it's the same concept, just specifically with masks. So one thing I will say with masks, it was probably one of the first products or PPE items that really became very high demand. And when that demand hit, many people, everyone was essentially frozen as to what your previous demand was. So I'm sure a lot of you were experiencing things like, you were on allocation, you were restricted to certain limits, how often, how many you could buy, just because the demand skyrocketed overnight. And quite frankly, the inventory just wasn't anywhere, to support that increase in demand. So come April, and I would say there was other avenues, there were starting to be other sources that started manufacturing PPE, like the masks. So we were able to then, order more, but you can still see that dotted line of inventory or product that was actually being received was still way, 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 below the actual demand. And then the next slide here, again, showing the same thing, but from a hand sanitizer aspect. I will say hand sanitizer was more of a constant of what we saw. We were able to get hand sanitizer in and be able to bring it in. I believe that was just due to the way it's manufactured or being able to be made. It's much easier than some of your other PPE products out there. So you can see, again, the demand was higher than what was being received in, but definitely closer in line versus, what we saw overall in PPE and with the masks. So taking a look at, this quote, this is just showing, what we're feeling from the industry, what we're seeing, and what other, home care agencies did as far as trying to be prepared and see where they sat at early time of everything starting to hit and shortage of supplies. So with that, I will turn this back over to Rob.
Yeah, thank you, Kendall. And from this example from Intrepid USA on how they kind of took control of things, and it's something that I saw with a lot of organizations that we work with that particularly that have larger footprints, multi-state, multi-regions. I saw a lot of examples of command centers centrally, corporately, and warehouses being set up for self-distribution, so going out, procuring supplies, whatever source that might be, location that might be, and pulling everything in centrally to a location or a small number of locations, and then reallocating amongst their larger organizations to ensure that the usage of supplies, was appropriately handled. And it sounds like also from the initial polling that we did, maybe we should have backed the question up a little bit into December as, look forward into 2020. But it looks like a lot of you on the line probably, maybe reacted early about to projections of COVID-19 becoming an issue in the States, when in fact in January and much of February, it was onesie-twosie cases, and it wasn't near what it looked like, from the standpoint of cases reported as it was in March. So great job if you were amongst those that got out in front of this thing early and got in inventory and and began preparing for what was eventual. So so I think everybody's in the same boat here, and probably understanding and living through the frustrations of the the perception or the reality of home care not being a national federal priority. And this is a statement from NOC, just reiterating that point. And there'll be a couple of others in here as you kind of read through. We just we were just challenged as an industry to get the dedication in terms of supplies that that we were looking for. And so this is from Dave Cosby at Kindred, and this is go ahead, Dr. Andrew, that's fine. They weren't getting anything. That was April timeframe. This is another statement from NOC in April timeframe, just talking about how resourceful we all became during that time frame. And so I'm sure many of you have same stories or additional anecdotal references to what you did to pick up the supplies that your staff needed to work their way through the challenges that we were having. But again, as stated here, creativity and ingenuity has limits when it comes to worker and patient safety. So incorporating a couple additional of the Axxess survey results, which by the way, has some great information, beyond PPE in it. And I encourage all of you to take a look at Axxess's COVID-19 site, in addition to a number of great links regarding PPE, a number of other related topics. It's a great resource for what you might be looking for, with regard to COVID-19 resources as a whole. And as you saw from the first slide there, obviously PPE was a challenge. And then this slide broke it into a little bit more detail on what items in particular were of greatest concern back in late March. And the N95 mask then and today still are a pressing issue. And I know the manufacturers of said N95 masks are working hard to ramp up production and push product out, but it continues to be a challenge today. So again, just summing up some of the political aspects of it all, the lobbying efforts, the message from home care that NOC conveyed back in April is that Congress should establish providing PPE to home care and hospice should be a national policy priority, and the rationale behind it was stated in the previous slide. But again, I think with home care being on the front lines and having the number of COVID positive cases they're caring for, in addition to staff that have been affected by it, certainly top priority for everybody on this call. So before I pass it back over to Kendall for some additional commentary on this, again, as mentioned in the opening, it's more than just those traditional kind of 4 boxes of products that we alluded to at the outset. So we're seeing, a demand and expanded list of items that are related to the pandemic and to how organizations are thinking about products of need that relate to patient and staff care. And as it says in the second bullet point here, just not only really for staff members' personal care, but how are we thinking about the patients? And Kendall will talk a little bit more about that down the road here. But just making sure the staff and patients are properly protected and cared for during visits. How are we provisioning PPE and diagnostic items? And again, the ingenuity and inventiveness of home care. When you can't find a certain type of item, that certainly led to the adoption of others, and we've seen that time and time again. If I can't get option A, then option B and option C look pretty good right now. So we're seeing a lot of ingenuity there as well. Kendall, you want to talk about some of the other PPE related items that I'm alluding to there?
Yes, absolutely. So in addition to your typical PPE items, there were bunch of different requests and runs on other items, such as any type of, hand sanitizers, your hand soap, medical grade disinfectant wipes like your Sandy cloth, Calvi wipes, and then any of the MRSA kits. If you think about MRSA kits, they have all of your disposable components in it, which, if you are caring for a, COVID positive patient, disposable, anything that you can use, obviously is going to be your first choice. In addition to all of your, sanitizing, cleansing products, there was also a bunch of need for diagnostic equipment. So you've got your thermometers, the pulse ox, and then any type of disposable product like, your stethoscopes, disposable thermometers, disposable blood pressure cuffs, and then also any type of potential kit that you can think of that had any type of component for PPE. That was another piece that drastically flew off the shelf. And obviously, if you think about kitting, it takes time to take all the components and make into a kit. So any type of kits, there's definitely pressure on that within the industry as well in general. So as Rob alluded to, stretching the inventory when you're able to, the CDC had put something out about, again, if you have N95s, which, again, is the gold standard out there for masks, if you have 5 respirators, you would cycle those through the days. So you would use one for a day, put it in a paper bag, then use your next one, and every 5 days you cycle through and you would reuse them. Again, not the number one thing that you want to be doing, but in times of trying to stretch inventory, everyone's doing what they absolutely can to make what they have last longer. So the impact on manufacturing, when we were looking at the charts earlier, we were showing what the demand was or what we were trying to get our hands on versus what was actually coming in the door as far as product. So this is what I like to call the trickle-down effect as far as manufacturing goes. So if you think about all these various manufacturers out there making PPE product or other related type products like diagnostics or that sanitation and cleansing products, first and foremost, there's a lot of production that just wasn't happening or was stopped for a multitude of different reasons. First and foremost, tons of raw material issues. There could have been a factory that 100% was staffed, ready to go, and they couldn't get their hands on a raw material, therefore they couldn't make product. Depending on where that product or that raw material was coming from, it could have been coming from a different area or country that was on lockdown or they couldn't get product in and out of. Another issue was if the manufacturing facility was in a hotspot, they could have had an outbreak or COVID positive employees, depending on how the exposure was or how bad the outbreak was. Sometimes they could shut down for a couple of days. Sometimes in extreme cases, they're shut down for 14 days if there's a lot of other potential exposure. So that hindered manufacturing capabilities. Then in the hot spots, right, if people were potentially in contact with a COVID positive patient, especially in the beginning when testing was not widely available. It still is a challenge today, even with testing. People at the even slightest bit of headache, cough, not feeling well, they were calling off because everyone thought potentially they had it. And then you've got the curfews and quarantines as well. We had heard there's certain instances and cases, and you got to think this is global, not just the United States, where certain cities were on complete lockdown. Nobody could leave, nobody could come in or out of the city. So if workers couldn't get into work or they couldn't get to the plant, product wasn't being produced. So there were tons and tons of challenges around manufacturing in general and making that happen as far as product. So moving into the PPE piece, obviously, PPE is a challenge. It continues to be a challenge. Obviously, it needs to be looked at from a whole continuum of care. There's lots and lots of talk around the acute care side. Home care still, I feel there's not enough attention in our space that needs to be as far as protecting the clinicians. So now we're moving into the post-COVID recovery and planning. And this is the area, right, that, nobody knows 100% what this is going to look like. But, we've got to start looking and planning for the future of this. So with that, I believe we have another polling question, and I will turn this back over to Tammy.
Thank you, Kendall. Yes, we do have another polling question. And as the questions come up, I will just ask that you respond to that. We'll give you about 30 seconds to put your answer in. I believe our PPE and critical supply procurement practices between early January and now and moving forward will stay about the same, change somewhat, or change dramatically. Very interesting, and I don't know where the audience is going to come in on this one. Kendall, any thoughts on that?
Let's see, I'm trying to predict.
I'll weigh in, Kendall.
What do you say?
Yeah, I think some pretty significant change, perhaps, in the way that organizations think about it. But
let's see if you're right, Rob. Let's see what the polls said. Stay about the same, 10%. It looks like Rob had it. Change somewhat at 38%. Or changed dramatically at 52%. We're counting on you guys for it to change dramatically and hopefully no more shortages. So Kendall, looking forward to the next piece of this.
Yeah, I'll take it from here, Kendall.
Okay.
For a little bit. So just, obviously there's been a huge financial impact here. Anecdotally, I've talked to organizations that have shot 5 times their supply budget, in just less than half a year. It just, everything is, with regard to the financial impact here is, has been pretty significant. On this knock piece of information, just saying PPE top the list of things that increase costs and lost revenues, again, ahead of staffing and so forth. So it's just, again, obviously you all, those that, are running home care organizations certainly understand, the financial impact here, but it has been significant. So the question is, as we look forward, when will this thing end? Obviously, everything in the news, we're having a spike here, but the true, kind of second wave that's been projected and concerned about is more in October leading into November timeframe. And so hard to say. And when the vaccines become available, how long does it take to get, fully implemented? And so this thing is by all belief not done yet. But the question is, when will it end? And so it's key to, I think, obviously apply the learnings that have been ongoing, and living and learning through what others have done, and being resourceful are still very much a priority, including with PPE. So some information here from a Frost and Sullivan publication that came out this month, and just kind of the belief that transformation of PPE in healthcare is it's got some pretty significant opportunity for change as we move along in time here. So what you're looking at are some bullet points that really talk about more longer term transformational, not what's right in front of us in the next few months, but kind of as we're looking ahead. So first bullet point I think is important, talking about organizations are going to continue to stockpile critical PPE supplies, and that's going to continue to grow and ensure some steady demand in the next 18 to 24 months. And I've got a slide right after this to substantiate some of that prediction. I'll get there in a second, Dr. Andrews. Sorry, I wanted to hit on one or two more points here. And also just looking at distribution strategies, perhaps changing. You're seeing some new entrants into the arena for manufacturing and distribution of the products to meet immediate demand. So as Kendall's talked about prior, for finding different sources for different products, a lot of alternate sources and distribution type options are popping up. And again, projections for M&A activities, and again, ensuring that we've got manufacturing capabilities here locally and reducing the dependence on importing supplies. So on the next slide, as I mentioned, we've got some projections for demand growth indexing for the next couple of years. So if you look at 2019 as your baseline for the face mask, gloves, clothing, and goggles and face shields categories, traditional PPE, as your baseline, and you look at the index, essentially, demand more than doubling over the course of the next couple of years. And, it's been, not all that surprising for those of you, living it every day. Those of us who have been involved in it from the supply side, not surprising, but, projections are strong for healthcare demand for PPE moving forward. So Kendall, a few home stretch slides here.
Yes, absolutely. Thank you, Rob. So moving forward, this is ever going to change, protocols, PPE needs, and what this looks like in home care. So moving forward, right, and these are more or less questions, do you leave supplies behind in the home? For example, thermometers, disposable type diagnostic products. Does that differ if it's a COVID positive patient or if it's a patient that's potentially suspected to be positive? Obviously you want your staff members wearing masks in the home, but do you also mask the patient? Is it all patients? Is it, if they're able to be masked, or is it just COVID positive or suspected patients? Is there going to be testing in the home? As testing becomes more widely available and at-home kits are more available, is that something that will expand into home care? And then longer stay, PPE kits. Do you start looking at PPE as far as there's a bundle or a kit? If a clinician has, let's say, 4 or 5 visits in a day, is there a PPE COVID positive kit that they can simply pluck out of their vehicle and here's what I'm using? Or if it's a just general PPE kit for a non-COVID positive patient, here's the kit that I used. So just different areas and things to think about moving forward and what this is going to look like.
I think on that note, Kendall, again, anecdotally, going back to the NOC town hall back in April, where there was a bit of a narrative case study on the VNS of New York and the things that they did with everything that was so impactful and in their service area, obviously, and they made some quite significant changes in what they did. They stated they became basically a supply chain organization that included security to protect inventory. They had to solve for both procuring the PPE and then the logistics of trying to get it out and in the hands of staff. And the kits that you just referenced, they in fact had kind of created their version of that to, where clinical staff come in and pick up those supplies from their local offices. So again, things to think about moving forward.
Yes, absolutely. 100% agree. So as I had mentioned in the past, looking forward, as far as learnings and opportunities for post-COVID here, in general, the whole entire continuum of care needs to be looked at as far as addressing the PPE shortage in need going forward. Historic demand obviously is out the window. Masks, gowns, gloves. It is in such high demand right now. Obviously, the demand is spiking, but the million-dollar question, where is that going to land? We know it's going to be much higher than it ever historically was, but at some point, that demand will decrease some. Just where it's going to land is the world of the unknown and what's trying to be projected and worked on right now. And then, what do we need to do to better prepare? Moving forward, there's going to be, potentially the next national, big disaster, another pandemic. What's the next thing that's going to hit that we need to be better prepared for in general? So, essentially, no one's caught off guard again, and there can be, better supplies, waiting in the wings. So with that, I will pass this back over to Tammy for our Q&A portion.
Sure, thanks, Kendall. Something that you said earlier made me think of kind of when I go in to do my grocery shopping at H-E-B, and they're limiting me on sanitizers, toilet paper, meat, just various items. Do you see a time when supply chain will limit what organizations can get, so that maybe that there's a distribution fairly among home health agencies? Do you see that ever happening, or is it truly just going to be first come, served basis?
So we did see some of that already. I would say some of the very high demand items, they were put on allocation. So I'll say like N95s, for example. Many agencies purchased very, very few or none at all. So when everything hit, everyone was on allocation as far as, here's what was being produced and what was available, and here's what you got. So unfortunately, if you historically didn't purchase any, you didn't get any. But if you had purchased, I'm just gonna say I don't know, 100 a month, you got your 100 or your proportionate share of it. So moving forward, though, it will get better. It has to, and I definitely see it being better where there are no constraints. But I don't know when that's going to be. I can see it taking quite some time.
Yeah. I can see that happening too. And you're always going to have those organizations that maybe have better cash flow and can plan a little bit better for upcoming spikes versus those that, truly may be on a month to month or even a week to week basis on a cash flow issue, that may find themselves short of supplies when they actually need it. We have a question here from Amy in Texas. She wants to know, with the reopening of states and in Texas particularly, now that that has stalled, do you think that maybe the summertime may also see a shortage based on where they're located, geographically located? So I think the question is saying, you know, like states like Texas that are stalling on their reopening, do you think you're going to see an uptick there?
As far as the
Kendall,
demand,
Mhm.
yes, I can take this one. As far as the demand on PPE goes, you know, obviously Texas, you know, they're, you know, experiencing a very large spike right now. You know, their consumption of PPE absolutely is going to increase. But I will say, in general, as far as the U.S. goes, the supply chain, or, you know, what's being produced or available in the U.S. essentially can be shipped, you know, for the most part, everywhere in the U.S. So I can see more PPE being channeled and being consumed in Texas, for example. And then, you know, other states, obviously, where the cases are lower, not as much as needed. You know, there wouldn't be as, but we are not, in general, the supply chain industry is not healthy yet on PPE. It's better than what it was, but they're not healthy yet. So I can see as these spikes go up and down, you're going to see the PPE availability potentially in certain products, you know, flux as well. Rob, anything to add to that?
No, I think you hit it exactly for what I was thinking about. It's you're right. It's where the spikes are. It will certainly channel demand and supply going that way. But from, you know, the standpoint of, you know, perhaps if you're only dealing with a local distributor, for example, then, you know, perhaps there may be some issue there. But beyond that, to Kendall's point, you know, we look at things on a national basis and distribution centers around the country, and, you know, being able to serve where the need is and move product as necessary. I think it's more just about, you know, those spikes and a big increase of cases here over the summer, you know, can certainly, you know, lead to a strain on the overall manufacturing demand and processes.
Excellent. And this kind of leads into the next question. Someone wants to know what the typical protocol of number of supplies to keep on hand based on the client and staff ratio. So do you recommend, you know, like a certain par level, I guess, for lack of a better word, for supplies on hand?
Yes. So I will take this one, Rob. I would say, looking at pre-COVID here, what we had recommended for par levels versus what we would recommend now and moving into the future have changed, right? The par levels have increased, definitely. So yes, there are recommendations. That is something, you know, moving into the future, I say completely needs to be revisited, revamped, redesigned as far as a, you know, PPE offering. Here's what you should have on hand and how many, you know, at that par level. So it's definitely going to look different, or it does look different currently, and it will look different moving forward.
Excellent. And Kendall, is that something that maybe you can provide to our attendees that we could send out possibly after this webinar?
Yes, absolutely.
Excellent. Thank you. Another question. Well, let me just kind of follow up with this one. We're having lots of questions, and thank you. Keep sending those in. Do you think it's better to stock up now based on pricing in anticipation of what might be coming? Or would you encourage people just to keep their par level? And I guess that's two-part. Do you see pricing going up, first of all? And if so, is it better if people go ahead and plan now and kind of, you know, prepare for what's to come?
Kendall, you want me to? I'll take an initial swing at it, and please comment further. Yeah. So one of the things that, you know, that we've seen, obviously with manufacturing constraints and alternate sourcing, and you know, just looking, you know, where the available options are. Obviously, over this period of time, we've seen some wide swings in cost basis for products, and So some things that, we may have been able to provide it, for 1 unit of cost, could be anywhere to 5 to 10 times more. And some of it's, certainly swung pretty high there in terms of cost. But on certain items, we've seen that come back. I guess, one example of that is in, procedure masks, surgical masks. The cost basis for those went through the roof, and many cases, well over $1, and then is swung back, pretty meaningfully. And, and so I think, I guess it would just depend on the item, for that. But I would just say for surgical masks, if you wanted to pick an item and guess on it, I don't necessarily see costs going, sky high on those again. I think, production in a lot of cases is caught up, and so has, a lot of organizations I've talked to have many months of procedure and surgical masks stored and on hand, to really kind of carry them through the rest of the year. So some of the, the larger players in the industry, have gone ahead and made those, big bets on, and they're out of, probably out of play for the summer here for, if you're in the need for surgical masks, for example. So again, supply and demand, and I think on certain items, costs are going to stay the same or come down to, closer to where they were pre-COVID, even with the larger spikes. It's all a function of manufacturing process and availability. Like Kendall said, on hand sanitizers, for example, you've seen a lot of players pop up domestically and providing different options for, the mainstream brands that have been there before. And so therefore, there are different pricing options there. So again, depends on the product, and, we can, have further discussion on that as well. Kendall, anything you want to add?
Yeah, just one additional little comment. Personally, any clinician that's in the field, I would just say whatever you typically may have carried with you the past on PPE product, with, as we talked about PAR levels, what PAR levels look like pre-COVID versus during right now, it's different. So I would definitely carry extra PPE, obviously knowing that, using it on every single visit, regardless of, if the patient's positive or not. It's the world of the unknown. You got to treat everyone like they potentially have it or have been exposed. So I would say carry more, or at least enough to, get you through, a couple weeks versus before, you would have had very little on hand of PPE.
Excellent.
Yeah, and particularly, hey, Tammy, I'm sorry, just one other comment on that. And I think, Kendall, to your point, some of that, depending on what's your, your distribution model, may have some bearing on that as well. So
Correct.
A lot of organizations, as you know, patient direct delivery is the mainstream norm, but I'd venture a lot of callers, may still, go the old school route of having supplies in a supply room at the office. And so the way in which you've historically thought of that, depending on what your distribution model is, may impact that. So for example, where, in our program where we're replenishing PPE supplies and other, immediate need supplies that staff have on a day-to-day basis directly back to staff homes, that PAR level, may or may not vary from, a bulk inventory that you might have in the office for staff to come and get. And, which also brings up another point in situations like this, just thinking about your logistics and how, I mentioned earlier where the BNS of New York, and these other organizations that have taken in huge amounts of supplies to redistribute to their staff, the logistics of redistribution is no small matter. And, something to think about on a go forward is, are you, how does this work for you? Where if you've got everything in the office and staff are having to come in, or you're having to mail it to staff, that is certainly one option, but another is direct replenishment back to staff homes, so they don't have to go anywhere to get the supplies that they need and of critical nature. So just wanted to add that onto that point as well.
Yeah, great discussion. And I find it really interesting that the non-HME, non-supply chains, typically they have gotten into PPE now. You know, you can find masks and hand sanitizers at Walmart and at your local convenience store. And certainly the pricing on those are not reflective of what we would expect to see. There's certainly some price increases going on there as they're second party providers of that PPE. I had sticker shock when I looked at what the paper masks cost, and they were, close to $2 per mask, but it's a resale environment. We have one more question that I think we have time for. And the last question is there an update on PPE protocol per CDC and CMS recommendation for home health patients based on their respective risk level for COVID?
So I'll take that one, and I can actually do a little more research, not to my knowledge from the CDC, but I can check because there are updates. Everything is changing, I feel like, every day. So I can double check, and Tammy, I can get that information back to you if I see that anything has been posted.
Excellent. Thank you, Kendall. And we'll get that out to our participants online. And then I'll just open it up to either Kendall or Rob just to kind of summarize for us. And then we will give you some final instructions for receiving your continuing education credit.
Yeah, so Kendall, I'll go ahead and just start with some quick closing thoughts. If you want to flip to the the review of key terms or key items here from the slides. Thank you very much, sir. Again, just to keep in mind that we all know everything about COVID's changed so much in the way that we live and that we work, and that for us caring for patients and taking care of your staff. So I guess I'd just like to reiterate a couple of points. One is just help continue support, encouragement of the lobbying effort to ensure, it's not, obviously, this industry's been lobbying a long time for the right amount of attention, and this just reemphasizes how important that is. And so any way that you all can help locally, nationally to support that effort, I think we're all better for it. And, just keep in mind, being prepared for moving forward. We've touched on a lot of it here, but we of course are happy to help with any efforts that you might have, but there are plenty of resources out there, so take advantage of them. And again, we appreciate you being on the call today.
Thank you, Rob, and thank you, Kendall. And I'll also point you to the Axxess.com resource pages. We have a page dedicated to COVID-19, which does have all the updates for CDC guidelines for PPE and all things related to COVID. That is absolutely free for anybody to access. You do not have to be an Axxess customer to actually go on the site, and we provide you links and free downloads. So in closing, I just want to thank both Kendall and Rob. I found this information just fascinating. There's a lot of discussion we can do on this, and I think it'll continue to be top of mind in the months that come. As a reminder, we're going to email everyone a link to the slide deck and a recording of today's webinar. You're also going to receive a post-webinar training evaluation. You do have to complete that to get your CEU. Once you complete that evaluation, we will email you your continuing education certificate. Thank you all again for joining us today as we deliver on our mission to empower healthcare organizations and professionals with the world's best technology solutions. Thank you and have a good Tuesday.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.